The Wisconsin Women's Health Foundation, in collaboration with the Wisconsin Well Woman Program, presents this short video about multiple sclerosis. As a chronic disease affecting more women than men, multiple sclerosis is a serious women's health issue. Please stay tuned as we're joined by experts from the University of Wisconsin-Madison to discuss multiple sclerosis, its impact on women, screening and diagnosis, and ongoing research occurring here in Wisconsin. With us today is Dr. Christopher Lucio, an associate professor of neurology at the University of Wisconsin School of Medicine and Public Health. He's also a mechanical engineer working on devices to help those with disabilities. Dr. Lucio has been treating MS patients for over 12 years and is currently conducting multiple sclerosis clinical trials at the University of Wisconsin. Also here to discuss multiple sclerosis is Dr. Colleen Hayes, a professor of biochemistry at the University of Wisconsin, who has been researching MS and vitamin D for over 25 years.
I'm often asked, what is multiple sclerosis? And the best answer to that is it's a neurodegenerative disease that we attribute to the loss of myelin, which is a protective coating around the neurons. So it's a demyelinating disease of the central nervous system. So your central nervous system is your brain and your spinal cord. And what we can see when we look at the brain and spinal cord of a person with multiple sclerosis is that the myelin coating that surrounds an axon has started to degrade. So that myelin coating is what axons need in order to communicate with the rest of your body. So an electrical pulse actually moves right down the axon. When the myelin sheath is not there, it's like an electrical wire without its insulation. The information coming from the brain doesn't get all the way to the tips of your toes.
In multiple sclerosis, the cells that produce that myelin are abnormal, and the myelin is abnormal. And because of that, messages between the cells may be lost or may be very slow. Sometimes the immune system sees that abnormality and decides that it does not like what's going on, and the white blood cells from the immune system cross into the brain and destroy what it perceives as abnormal. Hence, we have the attacks of multiple sclerosis, or the relapses. Only about 85% of our patients have relapses. The other 15% have a more chronic, progressive changes without the autoimmune component, without the relapses.
So it's probably a multifactorial reason for getting the disease. There are several factors involved. A little bit of genetics, a little bit of environmental, and possibly some virus exposure. It's unknown. Not only is the trigger for the disease is unknown, but the exact mechanism or the exact details of what's going on in the nervous system is unknown. The reasons why it's so variable from person to person is unknown. So it's a great challenge to MS scientists to figure this out, because once we understand what causes the disease, then possibly we can figure out a cure for the disease.
The prevalence of multiple sclerosis is rising rapidly in women. So, for example, in the 1930s, about the same number of men and women had this disease, about 1 to 1, or just a little bit tilted in favor of women, a few more women than men, 1930s. By the 1970s and 80s, there were twice as many women with multiple sclerosis as men. Now, it's 3 times as many women as men. The incidence is not changing in men. They are absolutely rock steady. Same frequency of men getting this disease. And in 50 years, it has tripled in women. This rise in young women getting multiple sclerosis must be coming from something in the environment that is changing. And it's changing in a way that increases their risk. So if we look at the age range of people with this disease, what we can see is people of all ages have the disease. Many people live a long life and manage their disease and do well. So although it's most commonly diagnosed around age 30, there are also people who don't have any symptoms until they're in their 40s, or even in some rare cases later than that. And I spoke with you about the trend of rising incidence in women. What we're also seeing is that it's being diagnosed earlier in women. So on average, 10 years ago, diagnosis in the late 20s.
It may be associated with genetics. However, there's no obvious passing down of the disease from person to person. Only one person in a family may get it, sometimes several. We believe, or we see, that in families, if one person has the disease, then there's a small increase in probability that other members of the family will get the disease. In twins, only 30% of the other twin in a twin pair will actually get the condition.
So the most curious thing about this disease is that prevalence varies with latitude. So at the equator, you might be surprised to know that MS prevalence is fewer than 2 people per 100,000. And as we move away from the equator, going to the north, and we get to Scotland, or northern Canada, or Norway, or Sweden, Iceland, we reach a prevalence that's 400 cases per 100,000 people. That's a prevalence difference of 200-fold. In terms of prevalence, there are other studies that show you can change your risk of MS by moving, by migrating. So if you are someone living in Ireland and you move to Australia and settle near the equator, your risk of MS is much, much lower than it would have been had you stayed in Ireland. The strongest susceptibility gene that we know about does, in fact, come from Northern Europe, but it accounts for only 5% of multiple sclerosis risk. What's the other 95% of multiple sclerosis risk? It's not that gene, it's not Northern European ancestry. It's something coming from the environment, not from the genome. If you don't have enough vitamin D, your risk of getting this disease and many other diseases is higher. For example, if you're a darkly pigmented person living in Wisconsin, you are not going to make vitamin D for most of the year. From about October to April, the sunlight is not strong enough to catalyze vitamin D formation in anybody. We are all deficient in the winter. And if you're dark-skinned, that length of time without vitamin D is even longer. It might be from September to May or June. Wisconsin was one of those states with very high prevalence. We, along with Minnesota and Washington and Maine, actually set the record for prevalence of multiple sclerosis. I think Seattle probably holds the top card there, but Wisconsin is a high prevalence state. We have approximately 1 in 500 people with multiple sclerosis. So Wisconsin, unfortunately, is on the list of high prevalence for multiple sclerosis. And I think it's likely that as you go north in Wisconsin, that prevalence probably is going to be higher yet than it is in the southern part of the state. It tells us that there is a factor somewhere in the environment that's linked to latitude. That factor is trumping genetics. It's trumping infection. It's trumping everything else. It's a dominant factor in determining who gets multiple sclerosis. Skin color has a major influence on your vitamin D level. because sunlight catalyzes the formation of vitamin D in the skin. And pigment in the skin is nature's sunscreen. So the more pigment you have, the less vitamin D you can make given a certain amount of sunlight. So if you are a fair-skinned person, you might spend a few minutes in the sunlight and get plenty of vitamin D. If you are a dark-skinned person, the nature's sunscreen is going to prevent you from getting as much vitamin D. And you may need to be in the sun for hours to get the same amount.
The first step in multiple sclerosis is making sure that we have the proper diagnosis. Multiple sclerosis diagnosis can be difficult. Sometimes it's very obvious. A patient comes to the clinic and they've experienced an attack of optic neuritis, loss of vision, and eye pain. That's a very common presentation of multiple sclerosis. Or numbness. In a young woman, for example, such a presentation is often thought right at the get-go to be multiple sclerosis. In the most common form of multiple sclerosis, relapsing, remitting multiple sclerosis, the most common presenting symptom is numbness or vision loss. Less common is an attack of weakness on one side of the body, or just one arm, one leg, or possibly double vision, or vertigo, which is intense dizziness, and the eyes tend to beat back and forth abnormally. It may also present with a change in bladder or bowel control, or it may present with symptoms of memory dysfunction, memory loss, difficulty thinking, or a change in walking. You'd be surprised how many young people ignore mild symptoms. But later we realized that was the first presenting symptom of multiple sclerosis. And most commonly, this is an episodic attack. In other words, the symptoms develop over a few days, then they resolve over several weeks, or sometimes just a few days. Sometimes people just brush off their symptoms. And later in life, they may experience something more intense. And then we ask them, well, did anything ever happen to you when you were a teenager, when you're 20 years old? And they say, yeah, you know, one week I was dizzy, but I was on a cruise and I thought I was just seasick. Some people say, you know, I thought I just slipped on my arm. So when we see a patient who has any of those symptoms, including weakness, and we have no better explanation, we image the central nervous system with an MRI scanner. Half the time, the diagnosis is easy. We see the spots on the brain or the spinal cord, and we might obtain spinal fluid analysis to see if there are markers for the disease. Sometimes we'll have an ophthalmologist do special examinations of the eye. But the most common way to diagnose the disease is not with imaging and not with spinal fluid analysis. It's with watching a patient and seeing what happens to them over the course of time. The diagnosis is based on seeing and measuring changes in the nervous system that occur at different points in time and in different places in the nervous system. Because there are a lot of people out there that have symptoms of MS but never develop the disease, and we don't want to label a person with a disease they don't have. So what we might do over a few years, or as long as it takes, is repeat MRI scans, repeat physical exams, and always listen to new symptoms if they should occur.
There are about 100 diseases out there that mimic multiple sclerosis, and it's the job of your neurologist to rule them all out. So you have to be patient with them and give them time to do so. You certainly don't want to be diagnosed with something you don't have, and you don't want your doctor to miss something that you may have. So early on, management is taking a medication and also maximizing one's health. Exercising regularly, getting rid of negative things in a person's life, for example, such as smoking, excessive drinking, if those things are present, reducing stress. But most importantly, it's exercising regularly. And exercise should be part of the management throughout the course of multiple sclerosis.
This disease is a chronic disease, which means we don't know how to cure it. But we're getting much better at controlling it and managing it. So it may look quite hopeless in the first place, but I'm actually very hopeful that with good exercise, good diet, vitamin D supplementation, good medical care, support from your family and from the Multiple Sclerosis Society, the disease can be held in check for a very long time, and it doesn't necessarily get in the way of your life.
MS is not a hopeless disease. Many of our patients live very normal lives while being challenged by the condition.
You have to take control of the situation. The first thing I want you to do is read as much as you possibly can about multiple sclerosis, formulate lots and lots of questions. We'll meet again soon and we'll talk about it. And we'll talk about how to treat it and how to combat it. I want you to start exercising. I want you to take vitamins. I want you to eat more healthfully. And most importantly, know that you are going to do all you want to do in life. You just have to take control of the condition.
For additional information about multiple sclerosis, please visit the National Multiple Sclerosis Society Wisconsin Chapter's website. Also, please visit the Wisconsin Well Woman Program's website to learn more about MS screening in your area. Thank you to Drs. Hayes and Lucio for their generous participation. The Wisconsin Women's Health Foundation is a statewide nonprofit organization providing women's health education, outreach services, and programming. Please visit www.wwhf.org for more information.